Good morning, everyone. Welcome to our session this morning on best practices in sex education. So glad to have you all join us today. Welcome. This morning's session started here is actually presented by ANSWER. ANSWER is a national sexuality education organization based out of the Graduate School for Applied and Professional Psychology at Rutgers University. We provide for professional development for educators all across the country, as well as resources for young people from K through 12. Some of the main programs that we offer at ANSWER are online and in-person professional development workshops. We are launching next month a certificate through Rutgers in adolescent sex education basics. Our foundation's core skills training in sex education. Sex Etc. is our magazine and website by teens for teens, and Amaze is our animated video series for middle school age students as well as Amaze Junior, which is for young people and their parents. So just wanted to talk a little bit about the programs that Answer offers before I introduce myself. My name is Dan Rice. I'm the Executive Director of Answer, and I will be your host today. I welcome you all. A little bit about myself. I've been in the field of sexuality education for over 15 years now, and I have worked at Answer for a good part of that time. And I have experience working with young people in public and private school settings, in incarceration backgrounds, in foster care programs, leading peer youth programs. So I've worked with a lot of different young people, as well as parents and educators in the school settings. So I'm thrilled to be here with you all this morning to talk about some of the best practices in sexuality education. The learning objectives for the next hour that we're together. By the end of the session, you should be able to identify at least 2 major structural changes to the National Sex Education Standards. The second edition is what we'll be talking about today, and explain how the National Sex Education Standards, the second edition, reflect some of the best practices in the field of sex education. So that's what we'll be looking forward to doing today. Our overview of our time together, we're going to start off just talking about the national sex education landscape, just so folks can sort of see where our organizations are coming from in the creation of some of these standards that we'll be talking about today. Then we'll be really zooming in on the National Sexuality Education Standards, the second edition, and talk about the changes from the first edition to the second edition. We'll be talking about some of the new lenses that were applied in the second edition, as well as some of the new topics that are presented there. And then we'll be talking about overall some best practices in sex education that you'll have seen put into play in the National Sex Education Standards, the second edition. So just so you have a sense of what we're going to be doing for the next hour together. I will be leaving about 10 minutes or so, 10, 15 minutes at the end for us to do some Q&A. I am joined today by Doug Cope-Barnes, who is our moderator, and at the end you'll see him pop up. And so if you have any questions throughout the presentation, please feel free to submit those through the question section or through the chat. And Doug will be keeping track of all of those questions as we go through, and I'll be sure to leave some time at the end to make sure I'm answering your questions. But feel free to go ahead and pop those into the chat as we're going along, and we'll make sure to get to your questions at the end. With that, I'm going to hop on in with the overview of the national sex ed landscape. Some of you may or may not know that across the United States, sex education is not something that has sort of a national standard. The standards around sex education are really state by state basis. And so across the United States, there's going to be some states that have mandates around sex education, some that are specific around HIV, some that will specifically say it needs to be comprehensive sex education, some that say it, should be abstinence-based. And so there's really a very wide range of things that come into play when we're talking about sex education in the United States. So believe it or not, only 17 states across the country actually require that if sex education is to be taught, that it needs to be medically accurate. So you would think something like sex education, we want to make sure, with all of the health topics that it's medically accurate, but there's actually only 17 states that require that. 26 states in the District of Columbia require that the information must be appropriate for the student's age. So there again, only a little bit more than half say it must be age appropriate. 9 states require that the program provide instruction that's appropriate for cultural backgrounds and not be biased in any race, sex, or ethnicity. And 2 states promote that the program must not promote religion of any form. Some additional facts here: 39 states require that the information on abstinence be provided. So that does not necessarily mean that it's abstinence-only sex education, but even if it's comprehensive, that information on abstinence must also be included. 28 states require that abstinence be stressed, and 11 states in the District of Columbia require that abstinence be covered. 19 states require the instruction on the importance of engaging in sexual activity only within marriage be provided. So those are often called abstinence only until marriage programs. 17 states in the District of Columbia require discussion of sexual orientation. 10 states require, and the District of Columbia require that the discussion be inclusive And 7 states, believe it or not, actually require that only negative information is relayed about sexual orientation. 19 states in the District of Columbia require the inclusion of information on the negative outcomes of teen sex and pregnancy. So you can see there's a lot happening across the country when it comes to sex education. Lots of, we must cover this, we must cover that, and if we do cover it, it should be approached in this way or it should be approached in that way. So a lot happening. And so I want to take a moment now to talk about the Future of Sex Education Partnership, otherwise known as FoSE. FoSE is a group of partners made up of Advocates for Youth, which is a DC-based advocacy organization around sex education. Answer, which I mentioned earlier, we're based in New Jersey and we focus entirely on school-based sex education. And SEEKIS, Sex Ed for Social Change, which does a combination of both policy and sex ed. And these 3 organizations have been meeting for over a decade now with the goal of really trying to advance the field of sex education, to provide some best practices. Up until 2012, there really was no sort of standards around sex education that were adhered to naturally. States were all sort of doing their own thing. There really weren't a set of best practices that existed to guide folks in schools who were implementing sex ed or creating sex education programs. And so the 3 organizations came together sort of with this eye of how can we sort of create some continuity across the country? How can we sort of move the field forward? And one of the things that came out of this was just a basic definition of what comprehensive sex education is, because there wasn't even really that sort of basic foundation that folks were talking about. And so some of the things that I want to highlight from this definition that FoSE puts forward around comprehensive sex education is that there's many different parts to sex education. This is not just about teen pregnancy prevention and or STD reduction. This is also about human development. It's about relationships. It's about decision-making and abstinence and contraception and all of those pieces being presented in a very medically accurate way and doing that in a very scaffolded way. So starting in kindergarten, going all the way up through high school. And so a lot of people will stop and say, whoa, 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 sex education in kindergarten, what are we talking about here? We're actually talking about laying those foundations for the things that we're going to be talking about, such as relationships that we'll talk about in high school. So in kindergarten, it may look like we're talking about what makes a good friend, right? Or what qualities do you look for in a friend? Because those are going to be the building blocks for us getting up to what are the qualities of a healthy relationship when we get older. When we talk about disease prevention in kindergarten, it may be something like wash your hands every time you eat, before you eat, or after you use the bathroom, or when you cough, cough into your elbow. Those are the bases of disease prevention. And later on, as they get older, we're going to talk about disease prevention in terms of HIV prevention and talk about STD prevention and all of those pieces. So as they get older, we'll see those pieces happen as well. Finally, the last piece that's included in the definition is that it should be appropriate, age appropriate, medically accurate, and culturally inclusive. Those are all pieces that we believe strongly are important in sex education in order to make it truly comprehensive. So again, FoSE puts forth this definition to be able to sort of present all the way around what's inclusive comprehensive sex education for K through 12. The next thing that the FoSE partnership did was start to put together the first edition of the National Sex Education Standards, which were published in the Journal of School Health back in 2012. And in the last 8 years, basically, since the first edition was published, we've received a lot of feedback from all over the country. We know that from some data that was collected through the CDC, about 56% of school districts across the country were implementing the first edition of the National Sex Ed Standards in some way, shape, or form. And we were saving all that information that we were collecting throughout the year to make sure that when we did get ready to do an update, we had feedback from people from all across the country to be able to integrate that feedback into what is now the second edition of the National Sex Education Standards. Things have also just advanced as a field. We have much more research that's available to us around sex education. and those best practices and what's informed by research also exists in the new second edition. Then we started to look upstream. And so the next thing that we created and published was in 2014, the National Teacher Preparation Standards for Sexuality Education. And in the National Teacher Preparation Standards, what we did was we created some standards that would be taught in educational pre-service programs in colleges and universities that were preparing students to become sex educators or teaching in a health education classroom, but teaching sex education. And so these were published in 2014 to sort of look upstream a little bit and should try and prepare people for the standards that they need to be high quality health education teachers around sex education before they step into the classroom. And then finally, recognizing that there are a lot of teachers out there who are already in the classroom but never got any sort of pre-work in their college preparation programs around teaching sex education. The professional learning standards for sex education were published in November of 2018. These are actually not a FoSE publication. I want to be really clear about that. The professional learning standards for sex education were created by a group that was convened by FoSE, which is the Sex Education Collaborative. And I'll talk a little bit more about the professional learning standards for sex education and the Sex Education Collaborative a little bit later. But basically, this set of standards is standards for teachers that are already in the classroom to be able to sort of guide their professional development around sexuality education. So it gives curriculum directors or department heads some sort of mapping and guidance as they're planning the professional development for the teachers in their school districts around what to think about for their professional development around sex education. So these three sets of standards sort of all work together as a pre-service and in-service, and the standards for what the students need to know being that sort of foundation. And so I'm going to talk a little bit more now and get into a little bit of depth around the second edition of the National Sex Ed Standards. As I mentioned, they were developed by the Future of Sex Education Partnership, and they were actually just released. The original edition was released in 2012. The new edition was just released earlier this year. The goal of the standards really was to provide some clear, consistent, and straightforward guidance around the minimal essential standards for K through 12 sex education. I really want to emphasize that this is the minimal essential and not the ceiling. So some folks may look at this and say, whoa, this is a lot of information that's in here. But really what's in there is what FoSE believes is just the basics. This is the bare minimum that students need to really grow up and be able to make informed decisions around their sexual health and to become sexually healthy adults. And as I mentioned earlier as well, they were developed to address some inconsistent implementation that was happening across the country. So we know nationwide that people were sort of just throwing programs together, and some students were walking away with really good sex education and other students were walking away with absolutely no sex education. And because sex education is implemented on a district by district basis, we also know that when it comes to professional development around sex education, some schools will do professional development that specifically focuses on this topic, other districts will not. And depending on the comfort of the teacher who's charged with implementing sex education, there may be a set of twins who go to the same school in the same district, and one of the twins has a teacher who's been through a professional development program and had, sex education course in college, and then another student who has a teacher who's just very uncomfortable with the topic. And even within that same school, those two students may walk away with very different levels of sex education. And so we really wanted to try and create some sort of guidelines for folks to be able to follow if they were going to be implementing sex education in their schools and in their classrooms. It outlined, based on the research that we have and the extensive professional expertise of many different organizations and people, what are the minimum essential content standards for K through 12 sex education. Now, even though it was the three organizations that really authored it, I want to say that it was looked at by a lot of folks. And so when you go in and you look at the standards, you're going to see a very long list of people who went back and looked at this and approved it and gave their endorsement behind it. it is planned, it's sequential. We wanted to take some of that randomness out of it and make sure that teachers are really getting to see the wide breadth of what we consider to be comprehensive. And we wanted to provide a clear context and rationale for teaching sex education content and skills at different grade levels that's evidence-informed, age-appropriate, and theory-driven. And I'm going to talk a little bit more about that in just a little bit. We also wanted to support schools in improving academic performance and addressing this content area to highly relevant students and directly related to high school graduation rates. We wanted to be able to present sexual development as a normal, natural, healthy part of human development and offer clear and concise recommendations for school personnel on what is age appropriate. I know when we do our professional development, that's often one of the most common questions we get is, I don't know what is appropriate to talk about with a 4th grader versus what's appropriate to talk about with maybe a 6th grader, right? And so where should we draw the lines about talking about different topics, and how do I answer a question that may not be developmentally appropriate, and how do I know if it's not developmentally appropriate? So we wanted to really provide some guidance. The other thing that was really missing back in 2012 behind all of this was the one place where all of the emerging evidence that was coming together through studies that had been done internationally that brought together the rationale for really providing comprehensive sex ed. And so the sex ed standards really was part of developing those, was going back and looking at all of the research that had been done. And we did the same thing now with the new edition, the 2nd edition of the National Sex Ed Standards. We went back and looked at all of the research that has been published since 2012 and brought that all together. And we actually brought together some researchers, some evaluators who did the research. They did a major literature review and looked at all of the different studies, and that will actually, their research will be published, I believe, in the December edition of the Journal of Adolescent Health. So if you're looking for that research, that'll be coming out later this year. So that's a little bit about the overview of why, who did the standards, why they did the standards, what was involved in the process, and what the rationale was. So if you're familiar with the 1st edition of the National Sex Ed Standards, you're going to notice that in the 2nd edition, there are definitely some structural changes. And so I just wanted to take a few minutes now to talk about some of those structural changes and really talk about the rationale behind those structural changes that we've made to them. So in the original edition of the National Sex Ed Standards, there were 4 grade bands. We had K through 2, 3 through 5, 6 through 8, and 9 through 12. In the 2nd edition, you're going to see a 5th grade band. And what we did was break down the high school grade band from 9-10 and 11-12. And there's a couple reasons we did that. One is that 9th graders coming into high school are in a really different place developmentally than seniors are, who are going to be leaving high school, right? And so there's, even within high school itself, a very large developmental range that exists. Additionally, what we were hearing from schools and districts across the country was that if they were in a school district where maybe the administration was not particularly comfortable with sex education being taught, they would leave it until 12th grade. And it might be 2nd semester 12th grade or the very last semester 12th grade that sex ed is being taught. And what we know statistically through research like the Youth Risk Behavior Survey that the CDC puts out is that each grade through high school, we know that more and more students become sexually active. And so in 9th grade, we have the smallest number of students who report being sexually active, but by senior year, we have even more students who are reporting being sexually active. And so if we leave sex ed all the way until 12th grade, we're missing more and more of those students getting the information they need before they become sexually active. And so to try and prevent that from happening, we broke down the high school grade band from 9-10 and 11-12 to really try and help school districts and teachers who are trying to make the case for doing sex education earlier to be able to do that. You'll also see some structural changes around the topics that exist. And so in the original National Sex Education edition, there was a strand called Healthy Relationships. In the new edition, you're going to see a section that's called Consent and Healthy Relationships. We really, based on everything that's happening in the world, in the age of Me Too and everything that's happened, we really wanted to make sure that consent is front and center in the second edition of the National Sex Ed Standards. And so what you'll see in the new edition is that there are consent standards at every grade level, all the way down to K through 2. Now, again, folks may be saying, how do you teach consent to a kindergartner, right? It's not talking about sexual consent. It's talking about, can I give you a hug, right? Asking another student if they can give them a hug. It's about bodily autonomy. It's about those pieces that we really want to help young people to learn about at a very early age, right? And then that will translate as they get older into talking about sexual consent, but at least giving them the basic idea of what that looks like and sounds like at a very early age is super important foundationally. The other difference that you'll see is there was an identity strand in the original National Sex Ed Standards. And we took that identity strand and we broke it into 2 separate strands. There's now a strand on gender identity and expression, and there's a separate strand on sexual orientation and identity. And the reason that we did that was because we were hearing from a lot of educators that they were not getting the difference between what gender identity was and what sexual orientation was, and folks needed more professional development around that. We needed to tease the 2 apart. And so we were very intentional about sort of making sure that in the new edition of the standards, the topics and the indicators that were related to gender identity were really in their own lane, and the sexual orientation standards were in their own lane. So help to better reflect the fact that these are 2 separate concepts, and that it's important to be teaching about both. There were also strands on pregnancy and reproduction, and then another strand on sexually transmitted diseases. And what was being covered on those 2 strands in a lot of ways were a lot of the same skills, researching resources. Where do you go to get medical, to get information on contraception, or where do you go to get testing on STDs? And so what we did was we merged these 2 strands together into one topical strand that's now called sexual health. So anything related to pregnancy and reproduction or sexually transmitted diseases is now going to be combined into this one strand in the sex ed standards called sexual health. And what we did there was really make sure we take a more holistic approach to what it means to be sexually healthy, instead of just focusing in on those 2 particular topics, right? So giving young people the skills that they need to be able to prevent and care for themselves and get treatment, for things like pregnancy, STDs, including HIV. And then finally, personal safety was a strand that existed in there, and we changed that to a strand that's now called interpersonal violence. A lot of people said, personal safety, when they heard that, they didn't really know what it was referring to. So we really just gave the name strand an update, but it still reflects things like bullying, sexual harassment, sexual abuse, dating violence, all of those things that may occur in relationships, whether they be romantic relationships or family relationships, peer-to-peer relationships. It's still in there. We just did a name change to sort of better reflect what the content is that's covered in that strand. What hasn't changed is the fact that the strands all break down into different sections that align with the National Health Ed Standards. So you're still going to see the pieces around consent and healthy relationships. You're going to see anatomy and physiology. You're going to see puberty. Oh, so these are the sections, that are still in there that look the same: anatomy and physiology, puberty and adolescent health. So the gender identity, the sexual orientation looks a little different. The sexual health looks a little different, and the interpersonal violence looks a little different. But here's the part, I jumped ahead of myself, my apologies, where they still very much align to the National Health Ed Standards. So they're still broken down by core concepts, analyzing influences, accessing information, interpersonal communication, decision-making, goal setting, self-management, and advocacy, which if you're using the National Health Ed Standards in your classroom, these all will look very familiar to you because these are all the concepts that are listed in there. So we wanted to make sure it was still easy to align the National Sex Ed Standards with the National Health Ed Standards as well. And the breakdown to the indicators still remains the same as well. So you'll still see the topic abbreviation, you'll see the grade level that it needs to be completed by, you'll see the National Health Ed abbreviation standard, and then you'll see the item number. So these do align with the National Health Ed standards, as I mentioned earlier. They were further informed by the work of the CDC's Health Education Curriculum Analysis Tool, otherwise known as the HCET. And the new edition was also informed by what is now in the professional learning standards to make sure that what teachers are learning is also what they're going to be teaching in the classroom, so that we're not missing anything in teaching the teachers, but also making sure that they are prepared to teach everything that we're asking them to be able to teach the students. So that's a little bit of an overview on the structural changes. We also, based on the emerging research, looked at the first edition of the standards through some new lenses, incorporated those lenses into the second edition of the standards. And so here's a little bit of information on what we looked at. The new standards have been looked at with a trauma-informed lens. We know that trauma is pervasive in our country. And that there are a lot of communities that are disproportionately impacted by trauma. Especially now as we do this session right now via video in the middle of a pandemic, we know that there are people who are experiencing trauma right now as we speak. And so the National Sex Ed Standards, the second edition, have been written with a trauma-informed lens and the understanding that experiences from both students and the teachers. We want to really be intentional about making sure that we understand that teachers also experience trauma, right? And that may be trauma that they're experiencing from today or trauma that they experienced as a childhood that they still carry with them. And that impacts what happens in the classroom. And so we really wanted to acknowledge that. And so one of the things that we did is that in the new version of the National Sex Ed Standards, there's a little asterisk next to the indicators that could potentially be triggering to students who have experienced trauma in some way. So you'll see this most commonly in the interpersonal violence section. There's a lot of people out there who have experienced sexual abuse very early on or sexual assault. So we want to make sure that when we're talking about those things, we're talking about them in a very sensitive way, and also make sure that we are giving young people a heads up that this is the topic we're going to be talking about in class today by doing something that we call giving a trigger warning. And a trigger warning is as simple as just saying, in today's class, we're going to be talking about rape and sexual violence, and we just want to make sure that if you need to take care of yourself in any way, please make sure that you're welcome to go down to the guidance office, to the social worker's office, or take care of yourself in whatever way you need to during this class. So that's what we consider a trigger warning and letting people know what they should be looking for as far as trauma in the new sex ed standards. The second lens that was applied was a lens of social justice and equity. And so one of the things that you're going to see both in the professional learning standards for sex education as well as the new sex ed standards is that we're calling attention to overt and covert discrimination, including institutional, structural, interpersonal, and internalized racism, conscious and unconscious bias. We really want to help teachers to look at their curricula really critically and try and pull out some of those biases that may exist in it. For example, talking about healthcare services, right? One of the most common things we hear is a teacher say, if you think you might have a sexually transmitted disease, just go get tested, right? And so while that just rolls off the tongue easily, we have to recognize that historically there may be a lot of distrust of the medical community because there's a whole history in the sexual health world of injustices that have happened to people of color and of whole communities, that when we say just go see a healthcare provider, it might not be that easy. It also might not be that easy because people don't have health insurance. People don't have access to health centers because maybe they don't have a car, and maybe the bus doesn't go to that part of town, or maybe they don't have the money to go and get tested, right? And so thinking about all of those pieces and really calling those out and talking about them as factors that we have to consider when we're teaching sexual health. We included these lenses into the sex ed standards and the professional learning standards to make sure that we are addressing those really important pieces as well. Intersectionality. Intersectionality is the idea that none of our identities exist alone in a bubble, and that we have many different identities when it comes comes to our race and our sexual orientation and our gender identity and our socioeconomic status. All of those pieces inform who we are as a person, but that's called intersectionality. And so we wanted to make sure that we're looking at the relationships between both the marginalized identities and the, what we call up identities or the privileged identities that we all share, and really reflect on the impacts that they have on both ourselves and the groups that we work within. And so we're encouraging educators and administrators and curriculum developers to really take an intersectional approach as a guiding principle through all their sex education lessons. And so that was the lens that we used in creating the standards and indicators related to sex education in the second edition. And then finally, making sure we're using inclusive language around the LGBT community. So understanding that language is constantly evolving and we don't expect folks to know every term. We did want to make sure that we were using the most up-to-date terms. And so one of the things that we did with the second edition was updated the glossary. And so there's a really extensive glossary that exists now. And that glossary was created intentionally to meet all three sets of standards that I talked about earlier. So the glossary informs language that's in both the National Sex Ed standards, the teacher preparation standards, and the professional learning standards for sex education. You'll find those all in the same glossary. And then new topics. There were some new things that we added in here, again, based on the research that's emerging, things that we felt was important. Technology is constantly evolving in our country, and so we wanted to make sure we were accounting for the most up-to-date things that exist out there. So we made sure that all the advancements in medical technologies are in there, and they're in there in a way such that they are present, but will not be so specific that they are outdated in a year. We wanted to make sure that we were talking about the developments in communication platforms. Social media has really become ubiquitous with young people and the way they communicate. So we wanted to make sure that we were addressing that in the standards and talking about the impacts of technology within relationships. We focused heavily, as I said earlier, on bodily autonomy, consent, and sexual agency. We updated any laws and policies on topics such as bullying, sexting, and access and ability to sexual and reproductive health care that existed on a national level. So we wanted to make sure that even though we couldn't, make these super specific for each state, at least they resonated on a national level for folks around the country and had the most up-to-date information that existed. We made sure it's inclusive of power and privilege, conscious and unconscious bias, intersectionality, reproductive justice, racial justice, social justice, all the things that are super important in our time and did not exist in the first edition of the standards. There's an emphasis on recognition, prevention, and intervention of sex trafficking and sexual exploitation. As we know, sex trafficking has become huge issue in our country, especially in port cities and in states that have large and popular highway interstates. Impact of youth having increased availability and access to sexually explicit media, and especially pornography. That's important for us to make sure that we are keeping in the back of our mind as we're talking about sexual health, the things that young people have available to them that may not be medically accurate, that they're turning to get information on sex and sexual health. So all of these things are included now in the sets of standards as they exist. And in addition to the glossary, there's front matter that covers all of this information. It talks about all the rationales that I've just presented for you around why we talk about intersectionality and why we took a trauma-informed approach. There's an FAQ sheet that may answer some of your questions as you're looking through it for the first time. And we also have this available in an Excel file on the FoSE website, which is futureofsexed.org. So that if you're trying to map your standards or you're trying to map them in a way that's a little different than the way we have them laid out, you can go in, you can get that Excel file and you can sort of sort it and reorganize it to the way that you want it so that it's super easy to use and implement. We wanted to make it as accessible for folks as possible and as easy to use as possible. So again, futureofsexed.org is the website where you can find that. And at the end of the webinar, I'm also going to give you my contact information so that if you have specific questions for me, I can help you out with that as well. Best practices. Now, these are best practices in general, but they're going to very closely mirror what we just talked about in the National Sex Ed Standards because they are very similar. So the first professional best practice is getting professional development around sex education, right? The way we talk about things, the new technologies that exist, activities, skill-based, all of those things, it's really important to make sure you're seeking out your own professional development, or if you're in charge of a department, to make sure that your department's getting professional development. The professional learning standards, as I mentioned earlier, is a great way to map out professional development. So I want to talk a little bit about some of the resources that are available there. The Sex Ed Collaborative, just really quickly, is a collaborative that was first convened by the 3 FoSE partners, and we brought in even more state and national sex ed partners to get a really sort of national, on-the-ground look at what's happening in many of the states or geographic regions across the country. So we had Southern organizations, we had organizations from the Midwest, we had organizations from the West Coast, we had organizations from the East Coast. Recognizing that FoSE was sort of East Coast centric, we wanted to really get some more partners around the table. And so there are 19 national and state-based organizations that make up the Sex Ed Collaborative that created the professional learning standards for sex education, including the 3 FoSE partners of Advocates for Youth, Answer, and Seek Sex Ed for Social Change. And the professional learning standards really talk about what educators need to know in order to be able to effectively teach sex education. At the time that we were creating these, there were 12 organizations that were heavily involved in the program, but all 19 have signed on their endorsement to the standards. There are 4 domains of professional development. The first covers the context for why we teach sex ed. The second covers professional disposition and the things that a sex educator should be thinking about for them personally when teaching sex education. There's a section on best practices in the classroom, and then there's a section that covers the key content areas. And so we have the standards. There's also an assessment tool that an educator could go through, take the assessment, and then that will help to figure out what are the areas that you need the most professional development in. So if you're in charge of a department, you could have your whole team do this and then sort of take a look at what the areas of greatest need are to prioritize your professional development, or you can do the same thing as an individual. We have a 1-page summary. So for folks who don't have time to necessarily dig into all of the standards, it gives you an overview of the 4 domains as well as the topical areas that exist in those domains. And as I already mentioned, the glossary of terms, which corresponds with the National Sex Ed Standards and the Teacher Preparation Standards. So lots of resources available to go along with the professional learning standards as well. Climate setting is another best practice. Climate setting is super important for sex education. It's important in general, but really thinking about the things that you can do to create comfort in your classroom for talking about a very sensitive topic. So thinking about, do you do group agreements or group contracts or whatever you may call them at the beginning of the year? If you do, go back and visit them before the sex ed unit, because it's really important to make sure that you have things in there that are going to create that safe environment that you're looking for. For example, making sure confidentiality is in there, making sure we're covering ground rules around mandated reporting, super important when we're talking about sex education. So lots of different things that we could do, making sure that students all know each other and feel comfortable having these conversations, setting up ground rules for how those conversations are going to happen. All of those pieces super important in climate setting as well. The impacts of trauma. Pretty much every topic that we talk about in sex education has the ability to trigger trauma because of different lived experiences that people have. And so we just want to be really aware that, again, trauma is pervasive in our country, and trauma is not always evident. So you're not going to necessarily know that a student is living with trauma or has experienced trauma just by looking at them. And a lot of times trauma presents in a way that can often be taken as being a behavioral problem, right? Trauma manifests in many different ways. And so just understanding the nature, the range of experiences and the impacts of trauma are super essential to being able to effectively teach sex education and make sure that you're teaching it in a way that does not cause harm, right? Above all else, we're trying to make sure that when we're teaching sex education, we are doing no harm to the students who we're teaching sex education to. Culturally inclusive. Keeping in mind that diversity has sort of two dimensions, visible diversity and invisible diversity, right? So our visible diversity are the things that we can see. We have, you know, different genders in our classroom. We have different races in our classroom, maybe based on jewelry that people wear. We may know that there's different religions in our classroom, but we don't always know the whole range of diversities, whether that be sexual orientation because it's an invisible identity, or gender identity because that's invisible, right? And so just recognizing that when we look at our students, we only get part of the story, and we really need to be able to teach them things that are going to be inclusive of their cultural surroundings, because if we only come at it from what our experiences have been, we may be missing the boat completely. Because we recognize that a lot of times there are teachers who are in the classroom who may look very different from the students that they're teaching, and their lived experiences may be very different from the lived experiences of the students that they're teaching. So it's really important to be aware of your audience and be aware of the communities that you're teaching in, and just recognize that there's a lot of diversity, even diversity that you don't see. And it's important to try and address those pieces in your sex education programs as much as possible. Again, because sexual orientation and gender identity are invisible identities, making sure that we're being LGBT inclusive. And this means just using inclusive terminology and concepts, looking for things like, do all of the scenarios I use in my sex ed curriculum revolve around heterosexual couples, or are there examples that have same gender couples in there as well? Am I using language like partner that's inclusive? Am I teaching the information that young LGBT people are going to need to know to be able to protect their sexual health? All of those things are important to consider when we're talking about LGBT inclusive sex education. So I wanted to provide some resources here, some websites that you may want to go to do a little research on your own. My organizational website is answer.rutgers.edu. You'll find information about those many different professional development programs that I talked about at the start of the webinar. Foundationstraining.org is really an in-person skills-based training that can be done in your community. We have partners in 19 states across the country, so chances are there is a state nearby you that has a cadre that's trained in foundations and is able to come in and do the training for you. sexetcetera.org is our high school level team-based website. Amaze.org is our middle school website, and on there's resources for 10 to 14-year-olds. There's resources for parents of 10 to 14-year-olds. There's resources for using Amaze in your classroom. And I just want to say, Sex Etc., Amaze, these are all free resources. There's no charge to use. We have over 120 different videos on amaze.org in all of the content areas that are covered in the National Sex Ed Standards, and they're all free to access. And then the futureofsexed.org is where you can find the Excel sheet that I talked about earlier, as well as more information about the work that we do as the Future of Sex Ed Partnership. My personal contact information, drice@rutgers.edu is my email address. Like I said, I'm going to give some time for us now to do some questions, but if you think of something after the fact and you have some questions you want to ask, you can absolutely go and email me after the fact, and I'll be sure to make sure I get you the information. So with that, I'm actually going to ask Doug to join us. We're going to hop into some Q&A here and see what's on everybody else's mind, because I've done a lot of talking in the last 45 minutes. So love to hear from you.
Thank you so much, Dan. That was a lot of really good information. Very, very much. So yeah, so I will moderate some questions now. We have 14 minutes. So, feel free to put your answers either in the chat or the Q&A button at the bottom of your Zoom screen. We already had a few be submitted. One of the questions is, where can we find the resources listed, specifically the assessment tool?
So the assessment tool, I'm assuming for the Sex Ed Collaborative and the professional learning standards.
Yeah, that's what I think.
Okay. Yeah, so the Sex Ed Collaborative, I believe it's just sexeducationcollaborative.org, but I'm pulling it up on my phone really quick just to make sure that I'm giving you the correct one. Sexeducationcollaborative.org is the email, is the website for that, and you'll be able to download all of those resources for free on that website.
And Dan, would you mind just like typing that into the chat and sending it out to participants just so they have it in writing? Perfect. Thanks. And then we have another question asking, do you know if the foundation's training has been made virtual?
Foundations training has not been made virtual. That was quite intentional because it is a workshop that is designed to practice skills, and we strongly believe that skills need to be practiced in person so that folks are getting feedback in real time as they're practicing their skills. One of the challenges with doing skills-based training virtually is that if you're not getting feedback as you're practicing the skill, you can learn the skill improperly, right? And we want to make sure folks are not learning the skill improperly. So it is one of the challenges that we've had with foundations since COVID. And we started foundations about 6 years ago now, and built up this really huge network across the country. And we kind of came to a screeching halt when COVID came. We're hoping we're going to get back to a place where we're able to do foundations training in person, but for now it's sort of on pause a little bit. But I wanted to put it in there so that folks can keep it on their radar in case we get to a point where you start planning your professional development for the next academic year and you're able to be in person. Hopefully we'll all be able to be in person by then, and folks can consider foundations for one of their trainings. Just to sort of give you an idea of what's in foundations, there's a section on climate setting. There's a section on just understanding your local policy. There's a section on responding to challenging questions and harassing comments. There's a section on experiential learning. There's a section on values and a section on self-disclosure. So those are the different skills that we cover in the foundations training. Getting a professional disposition piece.
Super. Oh, well, those sound very, very, what's the word I'm trying to think of? Relevant for any educator, regardless if it's sex ed or anything. So
absolutely. We've gotten that feedback. It's also designed for K through 12. So it doesn't matter what age you're teaching, the skills are applicable and taught in such a way that they can be modified and implemented at any grade level.
Super. We have a request to put the list of the resources back up. They went by too quick. So I'm sure our production team can throw that back on the screen. And so we will do that here in a moment. And I have another question. Are the national sex ed standards required anywhere in the country?
The national sex ed standards are actually not required anywhere in the country. As I said earlier, there's no national mandate around sex education that really state by state, district, in many places district by district. And so they're not required anywhere, but they really are as I said, the first edition was implemented by about 56% of districts across the country, and they're really written to sort of be applicable anywhere in the country.
Okay. Super. All right, and I have another question. Is there any research that supports the use of the national sex ed standards?
Great question. So there's, because we just put these out this year, we have not done research on these standards, but the standards have been built based on the research. And so it's sort of a backward process in that, like I said, we did this massive literature review to pull together things that were not even necessarily thought of as sex ed, but let's say literature on healthy relationships, literature on sexual violence, literature on, let's say, sexual orientation and gender identity. And we pulled all of that literature together and used the findings to help us to build what would be the best practices and in turn, the indicators and the standards for sex education. And as I mentioned, that literature review will be published in the Journal of Adolescent Health, I believe in December.
Okay, great. That is great. Catherine has a question. She posted, many sex ed programs are now being offered virtual. How do best practices change in a virtual setting? Like what best practices shouldn't change?
That is a great question, Catherine. Yes.
That's a whole nother presentation.
It sure is. We could do a whole nother hour on that. But what I'd say is for presenting, some of the things that you're going to want to keep in mind presenting virtually is you still want to do all those things you would do in the classroom, right? You want to still do climate setting. You want to talk about how you're going to discuss sex education in this sort of environment. Are we going to use the chat? Are students going to submit their questions through another platform, which is actually what I encourage, because students don't necessarily want to have their question in a chat screen with their name next to it that somebody else could screenshot, right? So we want to make sure we're helping young people's confidentiality, right? We want to make sure we're protecting your confidentiality. So one of the things I encourage teachers to do is to make sure that you're in an environment where it doesn't share too much about yourself personally that you don't want to disclose, right? So if there's pictures hanging somewhere in your house or artwork hanging somewhere in your house that you feel like would disclose something about you that you don't necessarily want to share with your children, maybe move to a different room in the house. Or take down those pictures for the time that you're teaching, or whatever. Also make sure that we're aware that if the students are home, there's probably an adult nearby, right? And if a student's not using their earbuds, the parents can also hear anything that you're going to be sharing through the sex ed program. And so there also may be younger brothers and sisters. And so when we're thinking about that developmental appropriateness, we may want to encourage young people to use their earbuds while you're teaching a sex ed lesson, especially if they have younger siblings in the room who the information may not be developmentally or age appropriate for. Keeping in mind, students may not want to ask their questions because if the parent's in the next room, right, they're not going to want to vocalize their question, which is again why it's important to think about another platform where they could submit their questions through. Know the technology that you're using. If you're using Zoom, use your breakout rooms. Use that opportunity for folks to engage with each other. Let there be some opportunities for use video. Incorporate things that are still going to be interactive and entertaining to the young people that you teach, but just sort of keep those the new environment they're in, front and center in your planning. It's a great question.
Super. Okay, Angie has a question. Does the second edition include information inclusive of disabled people? And I'm assuming that may mean like physically and or developmentally.
Yeah, so we think many of the standards are inclusive of people with disabilities. We think where the where the not the information, but where the practice needs to change is the implementation of how we relay that information that may be different for people of differing abilities. And so, for example, the information that young people need around healthy relationships is fairly universal. However, if we're talking to a person who has typical developmental needs, we're going to talk about it one way. Whereas if we're talking about a person who may have autism, we may talk about it in a different way. And so it's really about the delivery of the information, and the standards don't really get into the delivery of the information. The content really is the content, and the skills are really the skills that all people need. And we, SECUS, Sex Ed for Social Change, actually just recently put out a whole toolkit and a call to action for really making sure that sex education is more inclusive for young people with differing abilities. So you may want to check out that on their website, which is secus.org.
Thank you. All right, another question from Marin. Is curriculum bridged to include interpersonal violence and mental health, suicide, substance use resources? So,
I'm sorry, can you say that one again, Doug?
okay, yeah. Are there curriculum out there that include education or training around interpersonal violence, but then also link in mental health resources, substance use resources, because there's usually a comorbidity or a co-occurring behaviors that are happening. If there's interpersonal violence, then could be substance use going on or mental health issues.
So the one curriculum that I can think of is the 3 R's curriculum. It's rights, respect, responsibility. It's just called the 3 R's curriculum, and it's offered through Advocates for Youth, which is one of the FoSE partners. It's a K through 12 curriculum that integrates the Amaze videos, but it also covers the national sex ed standards. And right now, since we just did the update, they're also creating some additional lessons to make sure that they cover the gaps that existed from the first edition of the standards to the second edition. It's a very comprehensive K through 12 curriculum, and it's absolutely free. It's all downloadable. You can download the grades that you need. You can pick which lessons you want to choose. It's all mapped to the standards, and it's, in my opinion, the most comprehensive and inclusive curriculum that exists today that really covers all of those pieces. There's going to be some slight connections. I know that there's some lessons in there that make the connection to alcohol. There's lessons in there that make connections about social media. I know there's at least one lesson on mental health pieces. So you'll definitely find some of those in there. I don't know that it'll necessarily go into the depth that you're looking for, but that's where I would start.
Yeah, and I am familiar with the 3 R's curriculum as well. And it's a great resource, especially because it's free. I mean, like, you can go and download the lessons. They're very user-friendly. So definitely highly recommend. And I think we're at time, but before we go, I just posted our breakout evaluation link in the chat window. Please, please, please just click on that, take 2 minutes, evaluate our session, just so we know what you thought. Your feedback is super, super important, especially since this is our first virtual conference. So also the evaluation link is on the session page in the virtual agenda. So you can also find it there, but please do that. And I'm being told that Google Chrome or Firefox browser is the best way to access the evaluation. And with that, I just want to say thank you, Dan, for some great information, some great resources. We really appreciated it. Thank you so much.
All right. Thank you, everyone. Have a great day.